Sanibona, uDr. Mlungisi Dongwe Luminjalo Medical Centers in Pietermaritzburg, KwaZulu-Natal. Itopic yethu namhlanje ukuthi COVID-19 noma coronavirus, yiziphi iy'nyathelo engingazithatha mina whether nginama-symptoms or anginama-symptoms, ukwazi ukuthi ngiprotecte umndeni wami, ngiprotecte labaseduze nami, ngiprotecte futhi nesifundazwe kanye ne-South Africa iyonkana. Bese siyazi, number one is that siyazi ukuthi igciwane leli lisemaphaphishweni and liphuma ukuthi umuntu ngesikhathi ekhwehlela lingaba basically ebusweni bakho esezandleni zakho, ngoba ngabe uthi ujwayele ukuthi uthinte izandla ngesikhathi ukhwehlela. So basic procedures akhona ukuthi sikwazi sivikele abantu bomndeni wethu, sizivikele nathi as well. Basic hygiene, meaning hand washing, regular hand washing. Okay, number one, amanzi anensipho abalulekile ukwazi ukususa amagciwane angaba khona ezandleni zakho. And then uma ngabe sikwazi khona nje kuthiwa ama-hand sanitizers, amanye alcohol based, ayasiza now as well, not just ukuwasha izandla kuphela but also not disinfecta ama-surfaces, indawo njengetafula, indawo njengemnyango labantu abaningi bezothinta khona ebengakwazi ukuthi, ngoba igciwane liyakwazi ukuthi li-survive up to a few hours or after umuntu ekhiphile mangabe ekhwehlelile kuleyo ndawo leyo. Okay, kubalulekile futhi ukuthi uma ngabe ngikhwehlele into umongameli wayesitshengisa nje ukuthi khwehlela into the inside of your elbow, ngoba uzama ukuthi ungakhwehleleli ezandleni okuvamisile ukuthi uxhawule ngazo uma ngabe uthinta abantu. So khwehlela into the inside of your elbow. Ungakhwehleli futhi esilangalaleni la khona abantu abaningi, ngoba nalokho kungabhebhethekisa igciwane uma ukuthi usunalo. Funa sikhumbule futhi ukuthi abantu abaningi ababesikhathi ngenzeka babe negciwane babe asymptomatic, meaning kungabonakali impawu, abakhwehleli all that much, abanayo fever, kodwa ngenze ukuthi bayakwazi ukuthi balispread igciwane. Esinye istep esibalulekile kakhulu esibalulwayo as well ukuthi as-avoid ama-crowds, iy'ndawo lezi ezinabantu abaningi. Umongameli ukhulumile ngabantu up to 100, kodwa akusho ukuthi igciwane zizospread kuphela ngoba sekukhona abantu ohleli nabo abawu-100 or more. But in actual fact, what it means is that as much as possible si-avoid ama-crowds la kuzoba khona abantu abaningi. Ngenzeka ukuthi njengoba kuzoba iy'nkunguthela zephasika, lapho abantu banga-exposeka babe baningi bekhona as well. If ukuthi ezomdlalo njengokuthi sijwayele ukuhambela into o-PSL, ngenza ukuthi sijwayele ukuhambela mekhona indawo la kukhona abaculi abadumile, siyakhona. Ezinye zey'ndawo lezi ezingahlanganisa abantu abaningi, and awudingi abantu abaningi ukuthi babe nani negciwane ukuze bakwazi bathelele labo bantu. Ngaba abantu oyedwa, ngaba abantu ababili abanalo igciwane abazothi mangabe bephakathi nalezo zixuku bese kwanda kakhulu inamba yama-infections amasha ngenxa yani ukuthi abantu babe ndawonye kulezo zixuku. So umongameli unikezile-ke i-order yokuthi as much as possible for the next few weeks abantu aba-avoided these crowds, ngoba sifuna ukubona ama-numbers ama-infections amasha ayehla yini uma ngabe sithatha lama-measures. We all believe ukuthi it will definitely help ukuthi kwehlise ama-numbers of ama-new infection. Enye isixwayiso esibalulekile as much as possible ukuthi stay indoors. Abantu abehlise indaba yokuhamba, uma ngabe ngekho uhambo olubalulekile, mhlawumbe lumise emall, lumise endaweni enezixuku, lumisa erenki ebhizi downtown, ney'ndawo njengalezo zofaka khona ey'xubweni zabantu okungenza ukuthi phakathi kwabo ngenza ukuthi bakhona abanye abanale gciwane le-coronavirus. So as much as possible umuntu enze into esingathi khona nalento ekhulunywa ngathiwa self-isolation. Uma ngabe sokuthi umuntu usenempawu thizeni noma unomkhuhlane akazizwa ekahle, kubalulekile nalo muntu ezwela ukuthi as much as possible ahlale ekhaya kakhulukazi, ngoba sizama na ukuthi mangabe kuyenzeka ukuthi mhlambe kulula phela ukuthi usungasheshe uthole nawe igciwane nako ngoba uzizwa ungaphilile, but kulula ukuthi nawe ezwela ukuthi unalo igciwane ungakwazi ukuspread kwabanye abantu as well. So as much as possible, uma singekho isidingo sokuthi ngiye edrobheni, uma singekho isidingo sokuthi ngizithole ngingaphandle kwekhaya lami, angingayi khona. So ney'ndawo la abantu bekhona bechitha khona isizungu, ngenza ukuthi ama-tavern, ngenze ukuthi ama-night clubs, anabantu ababa baningi kakhulu, kuthiwa funa sizi-avoid as much as possible. Okay, kubalulekile futhi ukuthi umuntu uma ngabe ethina I'm at risk, I know someone osetestile waba positive, I have been out of the country, noma abantu akade nginabo recently khona abagulayo phakathi kwabo, esikoleni sami khona into oseteste positive for lesi sifo, then kubalulekile ukuthi wena uye endaweni eseduze nawe ukuze baku-advise ukuthi ungakwazi kanjani ukuthi uthole i-test ye-COVID-19. Iyenziwe nakuma-lab lawa azimele, but iyenziwe nakuhulumeni futhi as well. Ezinye zey'ndawo ezi-identifayiwe la KwaZulu-Natal, in particular i-Grace Hospital, esinye sesibhedlela leso esi-ideal ukuthi umuntu uma ngabe edinga ukuthi a-check-we for lesi sifo angaya khona ukuze akwazi ukuthi a-check. So kodwa into efanele siyibalule lapho ukuthi kakhulukazi sidinga abantu asaziyo ukuthi bane-risk thizeni. Kungenzeka ukuthi kunomuntu njengoba kade ngisho okade wena u-close contact naye oseteste waba positive, umuntu osebenza naye emsebenzini. Kungenzeka ukuthi umuntu osemndenini noma umuntu nje njengoba ngisho ukuthi esekubonakalile ukuthi ngempela yena utheste waba positive, mhlawumbe useyalashelwa indaba ye-COVID-19 noma ye-coronavirus. Then kubalulekile-ke nawe ukuthi either kuma-labs azimele esiwaziyo akhona nalana eMgungundlovu, akhona amadolobha amaningi ama-lab ayimele akwazi ukuthi atheste for i-COVID-19, and then noma umuntu aye kwi-facility kahulumeni ukuze athestwe as well. Into ebalulekile kuleso sikhathi kumele ukuthi nginama-symptoms, I've got the serious cough, ngiyakhwehlela, ngine-fever, I'm becoming short of breath, so sengiyasola mina ukuthi ngenzeka ukuthi nginalesi sifo. Then kubalulekile as well ukuthi ngifake i-mask. Kungenzeka uma ufika kuma-facility ahlukahlukene bese bethi sicela sikufake i-mask. Kwenzelelani lokho? Uma sisola ukuthi ngenzeka ukuthi igciwane unalo, sizama ukureduce i-amount of igciwane ozothi uma ngabe ukhwehlela lingakwazi ukuthi ligcine lithelela nabanye abantu. It's to protect number one yourself, ngoba uma ngabe ufake i-mask, especially the ideal one le ekwi-N95, uma ngabe unaleyo mask iyasiza ukuthi protect abanye abantu, but iyasiza ukuthi protect nawe as well. Futhi siya-advise abantu abasebenza endaweni la behlala khona bethintana noma bexhumana nabantu abaningi, especially abagulayo, indawo njengezindlu zakodokotela, emakliniki, izibhedlela. Kavese umuntu uma ngabe egulile lapho la ezoya khona, kula bantu azobe begula befika bezosibona, abanye babo ngenza ukuthi bana i-COVID-19. So siya-advise ukuthi number one, uma ufika wena as a patient ifika lapho musukuba reluctant mesithi sicela mhlambe sikufaka i-mask ngoba senzelana na ukunqamula noma ukwehlisa ukubhebhetheka kwaleli gciwane. Number two, njengoba ngisho ukuthi it's recommended as well abantu abasebenza ama-health facilities ukuthi nabo basebenzise indlela ethile yokuzivikela, and i-mask is a very important one. N95 mask, it's not that random nje le encane ehlala la phansi kwekhala kwesikhathi kubantu, kodwa ngazi ukuthi ibhola and icover ikhala, icover umlomo, and ine-seal e-proper, meaning akukho bikhona lutho olukwazi ukuthi lungene in between. So kubalulekile ukuthi umuntu ayibhekisise ne-mask asuke ayithenga as well, angasikhohlisa ayitshela ukuthi u-protected kanti i-mask ayisebenzisayo is inadequate. And then elinye iphuzu engifisa ukuthi ngilibalule futhi kakhulu ukuthi as much as possible, even though we've got lots of messages esiwathumelayo kubantu, the big messages are do not panic, rather have a plan. So uma ngabe ngizithola nginama-symptoms athile ukuthi mhlambe ngine-COVID-19, what do I need to do? What do I do to protect abantu around me? Basic hand hygiene, let's self-isolate, and then let us go to a health facility ready for ukuthi ikwazi ukuthi si-receive and yenze ama-test unnecessary ukuthi si-protect from lesi sihlava esibhekene naso as isifundazwe and nezwe lakithi. So uDr. Mlungisi Dongwe lo we-Luminjalo Medical Centers, ngiyabonga ukuthi ulalele uhlelo lwethu, and I believe ukuthi together with ama-measures lawa uhulumeni asawe-introducile sizokwazi igcine ukuthi sinqobe